Hello friends, this is Olga, mature medical student, and I had the traineeship of three different directions, I would say, pediatrics, obstetrics, and also internal medicine. And in this video I want to describe you by a few words each direction, each specialty, because they are quite different. Maybe the pediatrics and internal medicine, they are very close, but anyway they are different. So pediatrics is, I would say, it's smile, relax, not much time for the observation and visiting the patient, having a deal with their moms mostly and parents. Examination is not long, having a deal with totally different groups, like from 1 day years old up to 18 years old, almost adults. Having the deal with often infectious disease, with the COVID, with the tuberculosis, with infections of urinary system. Infections is a huge part of the pediatrics. So that is the pediatrics. And the working day longs up to probably 5 or 4 o'clock. They finishing to visit patients at maybe 11 o'clock. And then they have a lunch, and then they just discussing patients, receiving new results of different analyses, and thinking what to do with each patient. So it's like this. The next one is internal medicine. Internal medicine, here I'm just having the walk with my Molly. Molly. And I want to communicate with you because sometimes I'm too busy and just cannot talk to you more. But anyway, the internal medicine, what I can say briefly about it. A bit more hard than pediatrics, more time for examination, but anyway, doctors mostly are relaxed. They visiting the patient from 8 up to 1 o'clock. In 1 o'clock they have lunch, and after up to 4 or 5 or sometimes 6 o'clock they usually doing the also discussion, and they waiting for results for analysis. So basically it's almost the same. The difference that they do not have this dealing with the infectious disease almost. Internal medicine, it's about almost old people who I can consider old. For me it's like 80, 85 years, 90 years old. Sometimes there could be a bit younger, like 75 years old, 78 years old. But anyway, they are quite adult, I would say. During examination, internal medicine, they often have a problem with the heart failure, with strokes. They often ask patients if they understand what the day-to-day, where are they, how their name, what the name of their family members. That is internal medicine. And often the patients, they cannot speak normally due to the stroke and due to the quite essential age. So almost 90-95% they have a deal with those categories of patients. And their examination include ultrasound examination, also the listening of lungs, of the heart, almost the same as pediatrics. It's like this. Sometimes these two categories, they have emergent situation when some patients have, for example, breathing insufficiency, or the heart stopped, or something like this, and or sepsis, the infections in blood, like general infectious. They can have 1 or 2 stressful days, but actually they are not very stressful. this kind of work as for me. But I want to tell you about obstetrics. This the last semester, the last half of the fourth year, we had exactly obstetrics. The cycle, all subjects called obstetrics and gynecology, but we started to study exactly obstetrics. And on the next year, on the fifth year, we will study gynecology. So this time I had a traineeship in obstetrics, and I would describe it like stressful. No time to talk, no time to explain. They walking just immediately without saying goodbye, so they may tell you something and they stop on the half of the word and running. No time to eat, working extra hours. Patients are coming and coming, a lot of patients. Part of the patients are delivered unconscious by emergency. Major part of the patient, they're coming on their own legs, but they just plenty of them, and the time is for the working hours of the doctor. This doctor should accept all of them, all that crowd near the doors. What else? Having deal with the heart bleeding, with when people suddenly become unconscious or they have seizures or something quite frightening. Also, obstetrics is a surgical specialty, so they are cutting, they doing the cesarean sections. They also have the deal with the physiological birth, and during that there also could be the tissues may turn apart, so they should be sewed up after. So this also this kind of surgery. They working extra hours, but anyway, the obstetrics not always and every day like that. There are some departments of obstetrics are more stressful, and departments like more relaxed. The relaxiest department is the department after birth, when the woman they already gave a birth and they just waiting few days in this department to go home, and they calmly, relaxedly should be checked. If everything is fine, they go home. It's the most relaxed department, where people can explain to the students something, may more calmly speak to each other. They're not that stressed. And also a bit more stressful departments, it's like ambulatory check, because each pregnant woman each month should have a check of blood results, of pressure, of ultrasound examination of the fetus, of the future child. And it's stressful because there are a lot of women behind the door, and for example, doctors should from the 8 o'clock up to the 11 or 12 o'clock accept all of them. But if there are a lot of people, a lot of pregnant people, this doctor should be hurry up, and so they always hurry, next, and this is the why it's stressful, especially for residents, for students who doesn't know what to do and afraid a bit. Yes, it's a bit messy. But the hardest part, the hardest departments where doctors work and residents work, it is the ambulance of a pregnant woman, and it's just a nightmare. It's 12 hours from 8 to 8, from 8 of the morning to 8 of the evening, and there these residents and doctors, they're just running. They do not have even time to sit calmly. They often do not have time to eat. The rooms where the women they gave birth, I think their doctors, they kind of a bit stressed inside sometimes, but actually they pretend or they look a bit like relaxed or polite, I don't know. Yeah, but in general I think it's much more stressful than the pediatrics or internal medicine. But also I will have the traineeship soon for the surgery, and even obstetrics doctors said that surgery is extremely hard, is very hard, and that's why I'm just very interested and curious to know if really surgery is so stressful and much more stressful than obstetrics, because when I was during this rotation exactly in obstetrics, that period I was very tired, and you can imagine that I'm just a student. I didn't do anything. I just was present there, and I was very tired during that rotation. So I don't know what will be on surgery. And that is my impressions about the traineeship after 4th year in the hospital as a medical student.